Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Primary schools in Niger State to reopen in preparation for exit examinations. Delta State relaxes COVID-19 restrictions, reopens cinemas, hotels and restaurants. And the World Health Organization and the Africa Centers for Disease Control and Prevention launch a network of laboratories to reinforce genome sequencing of coronavirus in Africa. The Nigeria Center for Disease Control, NCDC, says it has received complaints from passengers departing Nigeria that airlines are rejecting COVID-19 negative results from some accredited private labs, and this should not be the case. The center says it is working with other ministries and agencies through the Presidential Task Force on COVID-19 to address the challenges faced by travelers to Nigeria. The NCDC identified the travelers as those using the Nigerian International Travel Portal. In the meantime, 197 new confirmed cases and 5 deaths were recorded in Nigeria last night. The NCDC reported the new cases from 13 states, with Plateau leading at 83, Lagos 48, Kaduna 17, the FCT 16 cases, Ogun State recorded 11 cases, 7 were recorded in Katsina, 4 in Imo, 3 in Edo, 3 as well in Nasarawa, while 2 in Rivers. Bayelsa, Oyo and Osun states recorded 1 each. Till date, 55,829 cases have been confirmed. The total number of recoveries are at almost 44,000, and 1,075 deaths have been recorded in the 36 states and the Federal Capital Territory. Total samples as at today stands at 433,206. COVID-19 update in Africa shows that the numbers have climbed and are now at 1,330,038 cases. Total deaths at 32,117, and over 1 million have recovered on the continent. The National Health Insurance Scheme has reiterated the agency's commitment to supporting the sustained efforts of the federal government to protect all Nigerians from the debilitating scourge of the coronavirus pandemic. The Executive Secretary of the NHIS, Professor Mahmood Sambo, said this while handing over a consignment of personal protective equipment to the acting chairman of the Economic and Financial Crimes Commission at the headquarter complex of the anti-graft agency in Abuja. Professor Sambo commended the strategies and initiatives being deployed by the nation through the Federal Ministry of Health, the PTF on COVID-19, and the NCDC to protect lives and livelihood of all residents of the country. But he expressed particular concern for institutions and personnel providing essential services whose nature of work predisposes them to a high risk of infection. He stressed that no effort must be spared to ensure their protection in the line of duty. The Delta State government has announced the reopening of cinemas, film houses, eateries and hotel restaurants. The State Commissioner for Information, Mr. Charles Anyago, briefing newsmen in Asaba, says hotels and restaurants must operate at 50% capacity, ensuring all COVID-19 preventive and safety protocols by the NCDC are observed. He also warns that the state government will monitor operations to enforce compliance, calling for places of businesses to be fumigated regularly. Ms. Aniago, however, says that clubs and lounges remain closed until government comes up with safety modalities for their reopening, asking the people of the state not to lose their guard in the fight to conquer COVID-19.
Owners of movie and cinema houses can now operate, but they can only do so at 50% capacity, in which case they are not going to just fill everywhere. 50% of their capacity, like for instance, if a theater is meant to take 50 people, it means they should organize it in such a way that they take 25 persons per time, and that they must constantly fumigate the the halls, just as they must also observe all the other protocols that we have really that were read out in the past, i.e., sanitizing or washing of hands of those persons who are coming into their theaters, and then, of course, wearing of face mask is compulsory for everybody who is going to access such movie houses. Now, hotels, some form of eateries can now allow people to eat in those eateries, but they must not encourage buffet. So in which case, they must, as much as possible, still encourage takeaway. But if the people must sit down to eat, they must ensure that they serve the persons and that all the necessary protocols are observed. The reason why we were asking them to discourage buffet is because buffet means that everybody will have to use the same spoon to be taking things, and then you are having a lot of people holding the same item. We cannot guarantee that a buffet will not further exacerbate the spread of the virus.
Let's now take you to Niger State, where our correspondent tells us that after over 6 months of being shut down due to COVID-19, primary schools across the 25 local government areas of the state are set to reopen Monday, the 14th of September. Here's Simon Emperor with more.
The Niger State government says it is confident that pupils in exit classes in primary schools can now return to school, especially to write the National Common Entrance Examination. And that's after training over 3,000 head teachers from across the 25 local government areas of the state. This is a cheering news, especially that schools have been shut down for more than 6 months now. The chairman of the Universal Basic Education Board in the state says that without iota of doubt, the safety of the pupils will be guaranteed.
The reopening process has just begun today with the training of head teachers as sponsored by Universal Basic Education Commission in collaboration with Niger SUBEB. As I'm talking to you, over 3,222 head teachers are undergoing training today and tomorrow for that is going to give a kind of a signal for opening of our schools. And I want to assure you that by next Monday, we are going to open primary 6 classes for examination purposes. However, we're not opening for all the students, for only candidates that we have registered for examination. We're opening for only the candidates that we have registered for examination. I can assure you that we have a maximum number of 500 children that will resume schools in various local governments. That is to say, in each local government there will be 20, and they will under the guidance and tutelage of their teachers for the purpose of examination. After the examination, we'll await the decision of Niger State Commissioner of Education on the matter of opening of schools.
Niger State currently has a total of 244 confirmed positive cases of COVID-19 with 12 deaths. At least over 2,000 suspected cases have so far been monitored by the state task force on COVID-19. Empress Simon for COVID-19 update.
In Ekiti State, there seems to be a slight drop in the level of compliance to the COVID-19 rules, especially the use of the face mask. The recent cabinet reshuffle by the governor, Dr. Kayode Fayemi, may be having its effects on monitoring roles, as 3 commissioners who have been key members of the state's COVID-19 task force have been replaced, and the new occupants of the offices perhaps just settling down. But the coordinator of the task force, Professor Bolaji Aluko, insists there's no cause for alarm, considering the moderate rate of new infections in the state. He says previous awareness efforts are still impactful, assuring that enforcement mechanism will be rejigged. A public health physician joins us here in Lagos, Dr. SHALLOM Oni. Thank you for joining us on the program.
Thank you, Millicent.
All right, let's start with compliance levels so far. There's a lot of complaints coming in around that it's still pretty low. We're seeing lower cases, which we're recording across the country. The PTF is saying states need to do more to drive this. What do you think is happening?
Well, it's a good thing that the compliance level, has come up a little bit, because if you want to look at the assessment of things generally, you discover that in offices, workplace environments, in public gatherings, even the eateries and co, discover they have really complied with all these guidelines. Then even by and large, in some communities, you see people complying with the face masking thing, washing of hands and things like that. But,
But not every, not in,
exactly, not at all.
places.
Yeah, at all. But then the cases are coming down. And I know why the PTF is saying that, see, you can't just lose your guard. You have to keep on driving this thing. It's not over until it's over. It's not over until they say we have peaked. However, that's questionable. Even if we have peaked, we are not recording 0 cases yet. So as far as we are still having cases, we still need to keep on with the MPIs, yes.
Dr. Sani Aliyu yesterday at the PTF talked about younger people driving this because, a lot of them are also the super spreaders of this virus, taking it to the vulnerable. So with the reopening of the economy, schools and what have you, young people have to be really careful. But do you think that our youth, that age range, understand what COVID-19 is and can drive the public messaging to ensuring that people are safe?
Exactly, that's where the question is. Because if for the past 6 months, you have been investing in getting the youth to be involved in each of the stages of COVID-19 management, now that the stage is set for them to go into the community, they will be the ambassador of this message. A sense of responsibility will be there. But do not forget that it's this same set of youths during the course of this pandemic that were even thinking that this is a scam. They didn't believe in it. So everything comes down to how the government at all levels have been able to carry themselves in ensuring community participation, especially, the youthful age that we have, in getting them involved. When you plan with a set of people and you execute together, they become the vanguard, they become the ambassador, they become the mouthpiece, of the message. So it's yet to be seen how the youths are going to be the drivers, of the message. Well, the level of education also comes to play here. If you're talking about educated ones, sure, they understand that COVID is real. But by and large, the largely unemployed or uneducated ones, they still have their doubts about COVID-19. So you can't really pin your hope on the youths, that they're going to be the drivers, of this campaign.
And still talking about that, around the world, they've talked about primary healthcare centers working, and this is seeing as we have this pandemic that they need to be more effective, and then, they can get to the grassroots. And we're experiencing community transmission. But do you see this pandemic as a platform for reform of our primary healthcare centers?
Well, I see, and I'm optimistic. However, the government has a lot of role to play, as far as ensuring that the primary care structure, uses this season, to become strengthened. How do I mean? We're talking about primary health care. We're talking about, affordable health care. We're talking about healthcare that's accessible to the people. We're talking about healthcare that is planned and executed by the community themselves. We're talking about healthcare that is implemented through appropriate technology. It's different from primary medical care or primary care, which is the first point of call of any patient, to health within the community. This is primary healthcare now. Now, this one has, it looks at the social determinants of health, like environmental factors, like economy and other things like that, or everything all together. So I think the government, still has a lot of role to play in ensuring that infrastructural, they try to use this season, to increase the primary care structure that we have. For example, according to national policy, there's supposed to be a primary health care center per every ward. Right now, we are falling short of that. That's one. Two, funding. Federal government is expected to devote their 15% revenue to healthcare. Then there's 1% consolidated federal revenue that's supposed to go to primary healthcare development. That is still not assessed by all the states. Then the states and local government need to come to the party and also ensure that their budget, for healthcare, it comes to the healthcare department. It's not just lip service. Not just, you can have a budget and they're spending the budget for you. It's one thing for you to have a budget, you're a vote controller. It's another thing for the vote, the budget really come to you to execute. So the government still have a lot of role to play in ensuring that they use this COVID-19 season, to strengthen the priority structure.
All right, thank you so much, Dr. SHALLOM, public health physician. Thank you for joining us on the program.
It's a pleasure to be here.
We take a look at the global response to the pandemic when we return. Stay with us. In Calabar, the Cross River State capital, residents are describing the constant use of the nose, the face mask as uncomfortable. A visit to the popular Wat Market and Etemedem Motor Park reveals that about 90% of buyers and traders were not putting on their face masks. Speaking to Channels Television in separate interviews, residents claim the use of the face mask in public places is discomforting.
Actually, this trade marks is type by type. Some of them you can use it and speak very well louder. Just like this one, it's elastic. Then some of them you can use it, you cannot be able to speak, even breathe in because it can suffocate anyone.
It's not easy. You just have to allow some air, you know. As you can see, I'm not even wearing one now. I learned there's a cure. If you get sick, you go to the hospital and get treated, that's all.
We are not comfortable with it. We are not comfortable with it because it will block our nose. But we normally use it. Like me, I have it, but I don't use it now.
But for the Cross River State government, modalities are put in place for compulsory use of the face mask in public places as it continues its sensitization of adhering to the COVID-19 protocols.
The garment factory has continuously produced masks like I told you, hundreds of thousands of masks monthly. And what we've done over time is we take those masks, we go out to rural areas, into urban areas, into the markets, and we distribute them for free. Human beings, by default, are social creatures. We like to be able to see each other's faces. So the nose mask is a bit of a discomfort for human interaction. Social distancing as well, because as social creatures, we like to be in each other's spaces. The average Nigerian likes some leisure activities, whether it's sitting at a bar, going for a wedding, going for some sort of social event. And so all these safety protocols have been a challenge to the normal functioning of the average Nigerian man or woman. That said, I don't think there's anything more important than life.
German Chancellor Angela Merkel and French President Emmanuel Macron have agreed to a deal that would allow unaccompanied minors from the Greek migrant camp to move to other parts of the European Union. Some 13,000 people in total have been living in the overcrowded Moria refugee camp, the largest in Europe. Now, the camp was destroyed in a fire earlier this week that left thousands in need of emergency housing. Local media reports that suggested that people started the blazes to protest the coronavirus lockdown measures. Their Deutsche Welle correspondent Malte Rover Kalman brings us the latest. He joins us from Berlin. Hello, Malte.
Hi there, how are you doing?
Very well. What's the situation on Lesbos, and has it been confirmed that the fire was set up because the refugees were protesting the lockdown restrictions?
Well, from what we hear, the situation over there is pretty dire. As you just mentioned, 13,000 people are now without shelter, roaming the island, have to sleep on the streets at night. There's not enough food, there's not enough drink to take proper care of them. And on top of that, there are also tensions between the refugees and some of the locals who'd always had a problem, even before the fire, with that refugee camp on their island. And now especially where after some coronavirus cases were confirmed there in the last few weeks. As for who set the place on fire, so to say, there's conflicting information. So the Greek migration minister has said, yes, this was set by refugees inside the camp to protest these coronavirus measures, whereas other sources say no, this is actually the fire has been set by some members of local far-right groups. So it's pretty unclear at the moment who exactly said it, but regardless of who said it, the consequences that these fires have caused are disastrous for the refugees and also for the island of Lesbos.
Well, what response has this event triggered within the European Union?
Well, 8 organizations have always kind of pointed to Lesbos, to the Moria camp, and have said this is a ticking time bomb. And now this time bomb has exploded, and obviously political attention also now turns there. And as you just mentioned, countries like France or Germany are coming up with solutions now to help these people who are right now in a very bad situation. And also there's been talk that the EU might assist and Greece in rebuilding the camp. But what this is that a camp like Moria is more a symptom of a wider problem, which is there is no common migration and asylum policy within the European Union, and that's why these camps exist, and they are prone to kind of the conditions there are prone to result in something like this fire.
So do you think that this will change something regarding EU's migration and asylum policies?
One should hope so, definitely. But the thing with European Union decisions is all 27 member states always have to agree on the same thing. And migration has been a very contentious issue, certainly since 2015, when a lot of people arrived. And there has been a group of countries called the Visegrad states. So that's the Czech Republic, Poland, Hungary, and Slovakia. And they have traditionally blocked everything that could have, posed a solution to this, like a quota system or something like this. Maybe this will now put under pressure the situation in Moria that highlights the consequences that this could have. Actually, at the end of this month, there's supposed to be a pact, an EU-wide pact that is to be presented, and it's going to be interesting to see if that's maybe going to be a step further towards a common asylum policy. But it's very, very unlikely, actually.
All right, we hope for a sustainable solution for the migrants. Thank you so much, Deutsche Welle correspondent Malta Rover Kalman. Thank you for joining us. Now, coronavirus is continuing to spread across the world with more than 27 million confirmed cases. Today marks exactly 6 months. The World Health Organization declared COVID-19 a pandemic, and cases of the disease are continuing to surge in many countries. Here in Africa, the WHO and Africa Center for Disease Control officials are launching a new laboratory network for more research as scientists seek to improve countries' responses and treatment.
The World Health Organization and the Africa Centers for Disease Control have launched a new laboratory network that will reinforce genome sequencing of coronavirus in Africa. The initiative seeks to study the possible mutations of the virus in order to prepare better responses in the public health sector. Experts from the WHO and the Africa CDC believe that the move will help countries understand the different strains of the SARS-CoV-2 virus in order to improve the country's responses, treatments, and possible vaccines and make them more relevant to the continent's population. Meanwhile, WHO Chief TEDROS GHEBREYESUS is calling for solidarity among nations and global leadership to defeat the pandemic, adding that divisions will only give the virus an opportunity to spread.
So I will again remind we will need solidarity and we will need global leadership, especially of the major powers in the world. That's how we can defeat this virus.
Elsewhere, France is planning tougher measures to combat coronavirus after experiencing a record number of daily cases. The country registered 10,000 new cases in a 24-hour period, according to Thursday's figures. The head of the Scientific Council advising the government on the pandemic, Jean-Francois Delfraisier, has warned that tough measures will be required.
You can take a closer look at some of the COVID-19 global numbers in real time. Visit our website. It's channelstv.com. There you get more updates and a better understanding of all you need to do to stay safe this period. There's several other stories as well coming in from Nigeria, Africa, and across the world. That's the program this afternoon. Thank you for watching. I'm Millicent Nwonka. Stay safe.